Welcome to the 354th Fighter Wing Live Coronavirus Virtual Town Hall. Today is April 6th, and this is our 5th update to the wing. I'm Kay Nissen, and today we have with us Colonel Benjamin Bishop, the 354th Fighter Wing Commander, Major Dr. Trevor Peterson, 354th Medical Group Chief of Medical Staff, and later Chief Master Sergeant Stephen Hansen, the acting 354th Fighter Wing Command Chief, will be joining us. We'll be taking your questions in the comments sections throughout the show, so please let us know what's on your minds. You may have noticed we're at a new start hour this time. We are trying to improve our streaming internet capability, but if we do drop off on audio, we can still see your questions and answer them. We'll also have leaders answering questions directly in the comments section, so don't be deterred to throw your questions in the comments. So up first today is the update, where we fill in all the changes from last week's show. Colonel Bishop, what do we need to know this week?
Yeah, good morning, everyone. Thanks for joining us. It's a new time slot. Hopefully the bandwidth will hold up as we have this conversation. So as we all know, the COVID situation is rapidly changing daily. And again, it's no change to that fact that it's constantly changing here at Eielson Air Force Base. So here's the update. In terms of cases in Alaska, what was reported to me this morning, you may have seen the same in local media, is 185 cases in Alaska. 53 of those are in Fairbanks. And by Fairbanks, we mean North Pole, the Fairbanks proper, and then Eielson Air Force Base falls into that. We had 7 new cases in that local area as well just yesterday. I'm sure there's a lot of questions since last week. Have we had any new cases on Eielson? And I'll be up front and say yes, we have had some new cases at Eielson. I'm not at liberty to share the numbers of those cases because of operational security concerns. You may have seen that in the media as well from the Department of Defense. We're just keeping tabs, and we're sharing the numbers with our local medical population, and we're reporting them up to higher headquarters, but we're no longer going to be reporting specific cases at Eielson. I can assure you, however, that that number of new cases on Eielson is extremely low. Now, I can also assure you that we have completed the contact tracing process associated with those cases, and that anyone that has had close contact with the individuals that tested positive have been notified and are currently residing in quarantine. So, as we see in Fairbanks, the cases are continuing to occur. And I expect in the future we'll probably have some more cases in Eielson as well. However, I'm confident that as long as we adhere to the guidance that we have given, specifically hand washing, personal hygiene, social distancing. If you adhere to that guidance, the risk to yourself, to your family, and to your Eielson team is going to remain low. So again, I consider this, we're at war. We're at war with COVID, with coronavirus. And the best way to combat this coronavirus is to take proactive means to follow that guidance and making sure that you're supporting those around you in that guidance. Speaking of guidance, there's also been some changes regarding formal guidance that we've issued since last time we met here in this forum. Specifically, I issued guidance in regards to grooming standards. Since all our barbershops and beauty shops are closed, we wanted to just give some clear guidance to our community and to our airmen how we're going to adhere to that. You've also seen that I closed the gym in abundance of caution and then reopened it after we did a full investigation of how we're going to implement social distancing procedures in the gym. I walked through the facility twice myself, and it is my assessment that we can provide a safe environment for us to exercise for our active duty and guard military assigned to Eielson Air Force Base in that facility. So again, a huge thanks to the Force Support Squadron for putting that together and making that happen. As far as other guidance, some of you may have seen that just yesterday the Department of Defense issued guidance regarding wearing cloth masks in public, and actually is mandating to the max extent possible that everyone on a Department of Defense installation wear a cloth mask when you cannot adhere to social distancing requirements. So think of, when you're in that environment, going through hallways, passing each other, maybe you're going through the checkout at our BX or commissary, those environments. So our leadership team is actually drafting a command directive that we'll release just as soon as we can in order to give kind of clear guidance to the local community here and then also to our airmen and their families. So that's a quick rapid fire update. Please, I'm sure there's lots of questions, so post those questions on the comment section and we'll go from there.
Yeah, I'll give my own shout out to the FSS guys. I got to go to the gym for the first time in a few weeks yesterday. It looked great. It looked very clean. I think everyone was working together to maintain social distance. So thanks to FSS for all you're doing. I know it's a tough job, but someone's got to do it, right? Okay, we're going to take a quick break. You're listening to the 354th Fighter Wing Live Digital Town Hall. When we come back, we'll be answering your questions, so please submit them in the comments section and stay tuned.
Hi, my name is Mark Simon, and I'm an emergency physician at FMH. I'm pleased to share that today Alaska's CMO, Dr. Ann Zink, put out a message encouraging the use of homemade masks for everyone when out in public. By homemade masks, we mean non-medical grade masks and masks that aren't used by healthcare personnel. We wholeheartedly support Dr. Zink's message and are encouraging everyone who goes outside to wear a homemade mask to cover their nose and mouth. Dr. Zink highlighted the reasons why in her news release, and I want to cover those briefly now. The main reason for the use of homemade masks is to protect those around you from you. We know that when we talk, when we laugh, when we cough, we emit tiny droplets. These droplets can contain infectious virus. We know that people with COVID-19 may have very mild symptoms or even no symptoms at all, and yet they are still able to transmit infection to others. That person with an infection, but little or no symptoms, may be me, and that person could be you. This is the reason for everyone to cover up with a homemade mask when out in public, to limit the number of droplets each of us emit, droplets that may contain the virus causing COVID-19. We know this disease is in our community. We know this disease is spreading. Public use of a homemade mask is one more step we can all take to limit our role in spreading COVID-19 in our community. Another benefit of wearing a homemade mask, other than decreasing droplet spread, is that it may help all of us keep our hands away from our face. Anything that helps keep our hands away from our face is a good thing. A couple things to keep in mind when thinking about masks. Wearing a homemade mask is not a cure-all. Shelter in place is the single most effective strategy we have to limit the spread of COVID-19. I want to repeat that. Staying home and sheltering in place is the single most effective strategy we have to limit the spread of COVID-19. Wearing a homemade mask does not give me or you or anyone else license to ignore shelter in place. It does not give us license to disregard social distancing. The use of a homemade mask when out in public is an added strategy to help limit the transmission of disease in those circumstances where someone has to be outside the home. So please remember, everyone, shelter in place. If you do have to leave the house, practice strict social distancing, a minimum of 6 feet apart, practice impeccable hand and face hygiene, and please wear a homemade mask. Thank you.
Here's how you can make your own face covering in a few easy steps with items you can find around the house, like an old scarf, a bandana or a hand towel, or you can make a face covering out of an old t-shirt. Fold it to the middle from the bottom, fold it to the middle from the top, fold it again to the middle from the bottom, and again from the top, and then 2 rubber bands, one on one side and one on the other side. Then you fold either side to the middle and you have yourself cloth face covering. It's that easy.
Welcome back. During the break, we heard Dr. Mark Simon of Fairbanks Memorial Hospital discuss the use of cloth masks. And I wanted to start with this topic in our rapid fire Q&A session. I actually saw a question pop up from Nelson Reck. He was asking specifically, will there be color or pattern guidance of some sort for these cloth masks that we're now encouraged to wear in public settings? So I think that's for you, Colonel Bishop.
Yeah, absolutely. So there will be guidance in terms of what we can wear and not wear in terms of masks. And we're crafting that guidance as we speak, actually. The team is working on it, and I'm going to review it right after this town hall. I will say, if you're getting ready to go out right now and you're wondering if you should put a mask on, I would say as long as it's conservative and non-offensive, put that mask on. So really our focus here is we're at war with COVID. What we want to do is arm ourselves with the maximum, to the maximum extent possible to fight that war and combat COVID. So I encourage you, if you have a face covering, go ahead and put it on. There's some links to the CDC website in terms of how you can make your own. Like I said, we'll get the formal guidance from the 354th Fighter Wing. We'll follow just as soon as we can. Doc, do you actually want to talk a little bit more about face masks and maybe what they do?
Sure, thank you, sir. So I think it's important when we talk about these face masks to understand what they do and what they don't do. We know that coronavirus transmits by droplets, and every time we cough, sneeze, breathe heavy, even speak, we emit droplets in multiple directions. The idea behind the mask is they decrease the distance that we emit those droplets, the distance those droplets travel and can potentially infect other individuals. This becomes more and more important even for things like loud speech or heavy breathing, because we've come to find out that the virus can shed from an individual before they even know they're ill. And so what the mask can do is decrease how far you're transmitting a potential risk to those around you. Fundamentally, these masks are meant to protect the people around the wearer. They do offer a small amount of protection to the wearer as well, particularly in that it keeps you from touching your face and reminds you to be cognizant of that. However, the masks are not airtight. If you're not fitted for a mask in a healthcare or industrial setting, these masks still allow droplets to get to you if you're within that cough bubble. So it can't be stressed enough that these are meant as an addition to social distancing and not a replacement.
Excellent. Thanks, Doc. So we got a few questions, so we're gonna jump right into them. So this one's from Stacy Celia. Sir, I think you can take this one. Will the commissary start limiting the numbers of customers allowed inside at one time to allow for easier social distancing?
Yep. So that's a great question, and I'm in close contact with DECA, who runs the commissary, not just for Eielson, but across the Department of Defense. And right now, there's no limits to the number of people that can go in the commissary at any one time, but that's something we're keeping our eye on. One of the things that is required within the commissary is that you maintain that social distancing, again, to the max extent possible. So as you're going through the aisles, I was just going through on Saturday, make sure you keep away from people as they're in the aisles as well. And then as you go to the commissaries, you'll look, there's actually places where you can stand waiting to check out to maintain that social distancing. And you've also probably noticed that as you're coming in, getting ready to unload your groceries, you stay at the end until the person in front of you has completed the checkout process. So as far as the commissary, again, we continue to evaluate the policies that we have and processes that we have there to, again, provide you that environment where you can safely go in, procure your supplies, your groceries, and do so in a safe manner.
And this is a public setting that the masks we would start putting on there too, commissary, AFBs, BX, yes?
Absolutely, that's a great opportunity to kind of wear your new cloth face mask out in public. Absolutely.
Okay, so we'll start seeing some masks out in our public settings there. All right, next question is coming from Heather Kennedy. Can you please elaborate on gate and visitation procedures and the dissolving of trusted traveler?
Yeah, absolutely. So if you go on our website at Eielson Air Force Base, we have a COVID website, and there we post all the command directives that are not for official use only. So all the information that I can give to the community in regards to the specific command directives that I've issued, we put that on our public website. If you go to Command Directive 14, that was posted on the 29th of March, you'll see that Trusted Traveler and Visitor Passes, that policy changed effective the 29th. And what that really means to you is Trusted Traveler has been rescinded. For those of you that may not be familiar with the term Trusted Traveler, when that is in place, that means you only need one ID to get through the gate per vehicle. Well, I've revoked that, so everyone needs to show their ID. And you probably, if you've been through the gate recently, you don't actually hand your ID. You actually just hold it up, and our defenders check it and scan it appropriately. So we're doing that for everyone in the vehicle. That means if you have a visitor in the vehicle, they need a visitor pass. Well, in addition to revoking Trusted Traveler, I also suspended visitor passes with the exception of approval of squadron commander or above. So really, as the whole state really is in kind of a hunker down mode in accordance with the Alaska mandate, we're adhering to that here as well. So the expectation is we don't have visitors unless there's some extenuating circumstance that requires it. So I just encourage you, please don't be going out and socializing with the community. People shouldn't be coming onto the base that don't need to be here for mission essential purposes or for people assigned here to use our commissary, etc. So that command directive is a way to kind of reinforce that message and to encourage everyone to, again, if you can, to stay at home as we ride out this coronavirus situation.
Yeah, speaking of mission essential and kind of enforcing that, I heard that security forces is actually taking some extra measures on base and checking to make sure that people who are transiting are actually mission essential. Can you talk a little bit more about that? Yeah,
so mission essential, that is a command directive. That's a formal order that I gave to the entire base. And like every other formal order and every other command directive, we're going to enforce it appropriately. So just like we have our security forces members, they do an outstanding job kind of educating and enforcing. So we're going to do that with all the policies that we have. Now I would say it's not important to fixate on that enforcement, fixate on what you can do in order to combat COVID. And the best thing you can do is take a proactive part in following these directives. Make sure you're informed, make sure that you know what they are. If you have any questions, I encourage you to talk to your frontline supervisor, talk to your chain of command, and we are more than happy to answer those questions. And this is why we do these venues weekly as well. And if there's other questions that come up from our community, that we can get that information out.
Right. Can you maybe explain why someone would get an exception to policy for a visitor pass?
It would be some sort of really extenuating circumstance. So maybe you have somebody that's needs support from a family member that maybe resides off the installation. But I would say if you feel like there's a need for you to sponsor somebody onto base, then talk to your chain of command, get your squadron commander engaged, and that's how we're going to kind of work our way through those situations.
Next question we have here is from Lisa Lacqua. Is there any way to increase machines and free weights that could be accessible for military members? Limited access creates long wait lines for certain equipment. So obviously the gym's open up again,
Yep.
awesome, but maybe we did shut down, I think, more equipment when we reopened. So any chance that we can open up some more machines?
I don't see that happening anytime soon. I will say when I did my walk through the Baker Fieldhouse twice, that's one of the things that we looked at. As we had a public health expertise, we had a medical group there with us to kind of advise on how to create the best environment to get an exercise workout done while maintaining social distancing. One of the big concerns we had is just everything that you touch in the field house, and one of the things that you touch are the weights and the workout equipment. So what we did is we reduced the number of those kind of contact points, and what that allows us to do is, one, just kind of focus our attention for those that are in the gym to be able to wipe in, wipe out of that equipment. And then also our FSS airmen are doing a great job going through and cleaning that facility on a regular basis. And by reducing the number of weights and the amount of equipment that we have, that allows them to concentrate that cleaning on those resources. So right now what we have is the best balance of being able to minimize the risk to exposure to COVID, and then also being able to maintain the environment where you can get a workout in, especially now that we're in breakup. It's really hard to exercise outside. So that's the environment that strikes that balance, and I don't see that environment changing in the near future regarding the number of weights available.
So Doc, when we kind of talk about the gym, and I went to the gym yesterday, I felt pretty safe, but can you kind of walk me through what are the actual things that I should be really careful of, even with all of these measures in place, when it comes to heavy breathing, when it comes to droplets, when it comes to machines? Can you just kind of tell us what you kind of chatted with FSS about, and when you actually went through the gym, and what needed to be considered as major threats to COVID?
Yeah, so I think the important thing to recognize is again, I said this earlier, but asymptomatic people, or people who do not feel sick, can be shedding this virus. So potentially the person who went in front of you in the gym was that person. We don't know that, but we don't have any proof that they weren't either. And so the idea you want to have, and the mindset you want to have going into a public space, whether it be the commissary, the BX, the gym, or your workplace, should be the same, which is assuming that the person who was there before you was shedding this virus. And so really think through all the small things we do every day, all the things we touch every day, from the pens we pick up to the doorknobs we touch, to the handles on the weights, specifically for the gym, and the door plates that we push as we go through push doors. You want to assume that every one of those has become dirty. Now, this isn't to make you paranoid or not touch anything or become the bubble boy from the 80s?
Yeah.
But to recognize that when you do have to touch those things, because living, you have to touch things, you don't want to then touch your mouth or face. And so you want to wash your hands regularly after going to public areas and using public things. This has been a great lesson for me, and I'm sure a lot of us, in how often we touch our faces. The virus does not transmit through the skin, so you don't need to be terrified of touching common surfaces, but when you do have to touch those common surfaces, you have to assume that the virus is there, and you'd want to wash your hands before you allow yourself to touch your face or other objects that would then touch your face, for instance, your toothbrush or a comb or other personal hygiene products, right? So I think that would be my mindset going to the gym or any public space, is assume every surface is contaminated, and after you have to touch it in those instances, wash your hands thoroughly with soap and water for a minimum of 20 seconds.
Great. I saw a few more questions roll in. We're gonna take a break in just a second, but I saw LK Adams. Do you think there will be a shelter-in-place order coming down? So I'm not sure if we're referring to the state of Alaska or, but if you have any thoughts on that, sir. I mean, we pretty much are in a shelter-in-place
Yes.
at this current moment.
Yep.
So
So I've restricted movement on base to mission essential only, and to the movement required to get groceries and essential supplies. You're also clear to go outside in order to exercise. But other than that, you should not be traveling around base or really into the local community. So I think that's my intent, and that's really the intent of the governor. As we combat COVID, we need to make sure we're staying in our residence to the maximum extent possible. So it's really difficult to overstate the importance of that, and the effect that it's going to have on combating COVID will be significant. Again, there are areas that you're going to have to encounter public spaces, and the doctors talked about the tools that we have to operate in that environment. But as long as we adhere to that, we're going to be just fine. We're going to be able to flatten the curve like we hear.
right. Yeah, so I think that might just be a confusion of terms, mission essential, hunker down, shelter in place. I think in essence it is all the same, and we are doing that right now, so I hope that answers the question.
Yeah, and if you have any questions regarding the guidance that I've issued, again, you can go to that website that we have established at Eielson with COVID. You can go to the command directives and then Command Directive 14 that kind of describes how we've declared limited movement on Eielson Air Force Base and what that guidance actually entails. And then again, if you got questions on those guidance, feel free to engage your frontline supervisor, your chain of command, or also post them on this comment page here.
Excellent. So I see more questions rolling in. We're going to catch up on those and make sure that we got good answers for you. So we're going to take a break right here. You're listening to the 354th Fighter Wing Live Digital Town Hall. I'm here with Colonel Bishop and Major Dr. Peterson. We'll be right back after this break. Thanks.
COVID-19 is an infectious disease caused by a new coronavirus introduced to humans for the first time. It is spread from person to person, mainly through the droplets produced when an infected person speaks, coughs, or sneezes. These droplets can land in the mouths or noses of people who are nearby. These droplets are too heavy to travel far in the air. They only travel approximately 1 meter and quickly settle on surfaces. This is the reason person-to-person spread is happening mainly between close contacts. The exact time that the virus can survive on surfaces is not yet known. So it is wise to clean surfaces regularly, particularly in the vicinity of people infected with COVID-19. Hands touch many surfaces, which can be contaminated with the virus. You should therefore avoid touching your eyes, nose, or mouth, since contaminated hands can transfer the virus from the surface to yourself. When coughing or sneezing, cover your mouth and nose with the bend of your elbow or use a disposable tissue. If a tissue is used, discard it immediately into a closed bin. The most effective way to prevent the spread of the new coronavirus is to clean your hands frequently with an alcohol-based hand rub or soap and water. This will eliminate the virus if it is on your hands. Stay healthy and prevent the spread of COVID-19.
Attention all 354th Fighter Wing active duty airmen. The base commander has restricted all non-essential movement and directed mission essential reporting with an emphasis on teleworking. Eielson Air Force Base is currently in Health Protection Condition Charlie. View an up-to-date list of facility closures at eielsonforcesupport.com. Upon arrival to Hersey Gate, present your ID with the barcode exposed and ready for scanning. Do not depart until instructed to do so. For more information and to receive the latest updates about novel coronavirus 2019, visit eielson.af.mil/coronavirus.
Welcome back to the 354th Fighter Wing Digital Town Hall on coronavirus. Thank you all for all your questions. We're going to wrap up those questions right here. I think the last two that I saw, we're going to go right now. So from Nicole Baldwin, sir, any word on how they are handling leave? They, I'm assuming, is Big Air Force. Are they going to go from 60 to 90-day carryover? That's use or lose for the rest of us.
Yeah, as far as Big Air Force, that's currently being considered. As we all know, this is a rapidly changing situation, and the Air Force is going to update its policies to best, care for airmen and families and ensure the mission. So leave is one of those issues that we're looking at as an Air Force. I will say one of the things I would like to highlight is here at Eielson, regarding leave, we've implemented a change. That was last week on the 29th of March. Basically, local leave is only in your personal residence. So if you have any specific questions on that, you can go again to the command directive that we have posted on our COVID page, and that's Command Directive 15.
Okay, excellent. And then our next question was from Siri Peterson. Any changes to how the CDC is to be utilized? The CDC meaning the Child Development Center.
Yes, so our Child Development Center is currently open for mission essential only personnel and their dependents, in order to allow them to continue to work and making sure that their children have the appropriate care that they need. I will say the CDC has implemented measures to the max extent possible to allow social distancing. I think we all know that trying to have kids social distanced is a pretty challenging situation to be in. So it's obviously not perfect. However, they're doing the best they can in order to create that environment that promotes social distancing to make sure we're taking care of our outstanding CDC employees that really do everything that they can to make sure that we can continue the mission. So my hat's off to the CDC employees, my hat's off to all the service employees and all the airmen across space and their family members that are in those mission essential duties that allow us to continue to operate and support our community and get the mission done while safeguarding our airmen and their families. So a lot of great work is happening each and every day as we're in this environment.
So Doc, speaking of the CDC, do you have any advice for people with children, right? I think we've talked about this. How do you keep children from, following all of these social distancing rules, the extra hygiene, those who are concerned about using the CDC? Is there anything that had come up in discussion with the public health office?
Yeah, the truth is, Kay, that the public health recommendations for children aren't any different than the ones we have for adults. Obviously, adherence to those recommendations is inherently more difficult in children. I'm not a child development expert by any means, but I think a lot of it has to do with rituals. We all do better when we ritualize something. So in my household, we ritualize washing hands on a regular basis at regular intervals, before we go to bed, before and after we eat. Things like that. That seems to help for our kids to be more regular at washing hands. Social distancing is a tough topic to broach because, especially with younger children, teaching them to stay away from other children can be inherently scary. and not terribly productive towards normal development children. So I don't have great advice during this time other than a distraction, which is developing activities for your children and for your family that are inherently more socially distanced and keeping busy, just for generally good psychological health. But yeah, children is a challenge, especially because we know that the younger you are, the more likely you are to contract this virus and not have symptoms at all. And so children do make a significant risk area for our population.
Excellent. Yeah, that just made me think, hey, shout out to our CDC caregivers. Thank you for what you're doing. It obviously a little bit more challenging with kids and taking care of our mission essential personnel. So that makes me think about mission essential, being able to use the CDC. How does one know if you're mission essential?
You know, because your squadron commander will tell you.
Okay.
So that is one of the things that we've kind of formalized is who is mission essential, who's not. I will say if you have a job on Eielson Air Force Base, you're mission essential, right? Otherwise, you wouldn't have a responsibility, or a job, if you will. Whether that you're in uniform, one of our government civilians, or one of our contractors, the whole team comes together to enable the mission. However, in this environment, we're using mission essential in order to kind of determine who can, stay at home, who can be able to kind of take a knee and fight the COVID fight from your residence, and then actually who needs to be on the installation supporting the mission that we're continuing. What that allows us to do is minimize the population we have on the installation at any one time, and what that allows us to do is adhere to social distancing, and here it creates that environment to make that easy. So again, that's why we have these command directives in place, these official policies that help kind of define what those roles are. There's questions that will come up. So again, I encourage everyone, if you have a question whether or not you're mission essential, talk to your chain of command, and we'll get you that guidance and make sure it's clear so there's no questions in place.
I saw a question just sneak in. We're going to take a break right after this one, but I think we answered this question. But Victoria Rowe, since you're listening, she asks, what about essential active duty members wearing masks while in uniform? Will it be allowed? And if so, do the masks have to be in the correct color? So I'll let you reiterate that point, sir.
Yes, it will be allowed, and we'll get guidance just as soon as possible.
Perfect. Okay. So we're going to run to a quick break. After this, we're going to do our scenario segment, and that's just where we talk about different scenarios that you could come into contact when it comes with COVID-19. So stay tuned. We'll be right back.
Right now, with still aggressive containment measures being taken to find and isolate cases in order to prevent spread, we want anyone with suspected exposure to someone with COVID-19 to reach out to their healthcare provider. You should do that by phone.
welcome back to the 354th Fighter Wing Digital Town Hall on coronavirus. We're going to start our scenario segment. So Colonel Bishop, Doc, I'm going to pose some specific scenarios we've heard around the wing and kind of get your take on what airmen or families should be doing in these scenarios. So if you're ready for it, I'm going to give you these situations. All right, so number one, I am mission essential. I've been reading all of the symptoms that I could possibly have for COVID. I do feel sick, but I don't think that I have COVID. So what should I do if I need to go to work because I'm deemed mission essential?
Yeah, great scenario, and one that's been played out a number of times over the last several weeks. The answer is stay home, right? And I can't make it any simpler than that. The medical community is begging people, if you are feeling ill, stay home. If you need further guidance, call the med group. We're happy to answer. We're open every day, and we have an on-call phone on the weekends. But if you're feeling ill, the unfortunate truth about COVID is we cannot distinguish it clinically by your symptoms from any other virus out there. And so it is just a roll of the dice what you have. Guessing whether or not you have COVID versus influenza versus the common cold is a fool's errand. You aren't able to tell the difference, especially in the early stages. And so you have to assume you have the coronavirus and stay home. If you need further guidance, call the med group. We're happy to take care of you. Hopefully that answers it. It is really quite simple. If you're feeling sick, do not go into work.
Even if you think you have just allergies. What about that? What if you have allergies?
Yeah, it's a tough question, admittedly, right? So some people, they get a cough and congestion with their allergies, which is consistent with a cold for other people. I will tell you that if you don't know, stay home and call the med group. We can help you sort through that. There isn't a perfect answer, just like there is no perfect test for COVID-19. But if there's any question that you could pose a risk to your unit and the mission of this base and the health of those around you, stay home, please.
Yeah, this is Colonel Bishop. And again, if there's any question in your mind, there is no question. It is your duty to stay home. Again, this is a war against coronavirus that we're in. And we all need to take our personal actions aligned with command directives and aligned with CDC guidance. So if there's any question in your mind, stay home. Again, it is your duty to do that.
All right, next scenario. In this scenario, I'm a male airman, so my hair is long, getting longer. My supervisor has been giving me a hard time for the last couple of days because, I look shaggy. But I'm uncomfortable cutting my own hair. Is it possible to ask my coworker, who I know can cut hair, to do it instead? What advice do you have for this particular airman, Doc?
Well, from a public health standpoint, unless that coworker is a member of your household, the answer is no. That would not be adhering to social distancing.
Okay. So let's say this coworker is my roommate, housemate.
Well, so I think that then is a member of your household,
mm-hmm.
and I think it's perfectly acceptable to have somebody else trim your hair in that setting. The vast majority of us don't work with members of our household, so for most of us it wouldn't apply. But if the person, your coworker in this instance, is your spouse or a loved one that you reside with, then I think that's acceptable.
Okay.
Yep. And then from a command perspective, we spell this out in Command Directive 16, where, consistent with social distancing guidance, members will not receive haircuts by members that reside outside their residence.
Okay.
So if you have a family member, then that resides with you, then you can have them try to cut your hair.
Yeah.
I will say from a personal experience, we just got our clippers in this weekend, and my wife is going to start experimenting on my two sons on that, and then I'm next eventually. So we have an opportunity to boost our marital communication coming up here. But if you happen to live alone, I'm sorry, but I can't have anyone cut your hair. You're welcome to try to use scissors or clippers to do it personally, but again, do not violate social distancing guidelines trying to get a haircut.
And really don't stress it, right?
Yes.
You're
Absolutely.
covered by the command directives,
Yep.
So no worries there. Yeah, and it's just trust-based experiment for everybody else who has a spouse or someone who can help them out in their household. All right, next scenario here is about the gym. So I go to the gym regularly, but I'm one who is very good about social distancing and very good about wiping down. But then I notice some people who are not wiping in and wiping out of machine areas in particular. Do I tell the FSS staff about this? Do I confront these individuals myself? How are we actually handling people who are serial violators of the wiping in, wiping out at the gym?
Yeah, so if you see that, I encourage you, one, maintain your social distancing, but just encourage people. It's like, hey, are you wiping in, wiping out? Just back each other up. I mean, we're all human, right? And we all are going to make mistakes. But as we, as a community, adhere to these directives, we'll be able to back each other up when we do have those breakdowns, those mental lapses. So encourage everyone to do so in an appropriate manner. I will say if that's not working, then I encourage you to let the staff know, and they have been empowered by me directly in order to make sure we enforce those standards. And if there are people that seem unwilling or unable to adhere to those standards, then we'll restrict access appropriately. But again, this is not an opportunity for us to divide our bonds. It's an opportunity for us to come together as a team to fight this fight. And I'm encouraged by all the excellent examples of leadership that I see across the community as we continue to combat coronavirus together.
Sir, I'd throw one more thing in there. This is a stressful time for everyone, and you never know what the person across the way is going through right now. What's going on with their family back home, their family nearby. And so one opportunity then is to offer to do it for them, right? And say, hey, can I wipe out for you? It's a gentle reminder, but it's also an act of kindness to our fellow airmen. And so I wouldn't be afraid of taking that approach either.
Yeah, as long as it gets done, right?
That's right.
Okay, I think those are all the scenarios that we had. I saw Gary Olson just snuck in a question. That'll be for you, Doc. He is asking, is the pharmacy still open for refills? I will be released from quarantine confinement this weekend and would like to pick up my refills on Monday. Thank you.
Yeah, absolutely. So pharmacy is absolutely open for refills. In fact, we've extended our services to the curbside. So you can fill prescriptions like you always would have. Call ahead, let the pharmacy know that you're going to be coming by just through the refill line. And then when you come to the med group, if as you drive up, you'll notice there's some boards on the left side of the parking lot, that main entrance. Those are pharmacy refill parking spots. Pull in. There'll be a number in front of you on the sign. You dial that number, the pharmacy will pick up, and they will bring your meds to you. You won't even have to get out of your car, Gary. This is in an effort to, again, minimize your exposure to our staff and our staff's exposure to the public. So, but full pharmacy operations are available for you. If you need new refills, just call, leave a message for your PCM team. We're happy to take care of that as well.
Innovation in action there at the pharmacy.
There you go.
Brilliant.
That's awesome.
Yeah, it's great. Okay, we are going to take a quick break. Actually, Doc, we're going to say goodbye to you. So thank you so much for being here. I don't know if you have any last words for us before we kick you off the show.
My pleasure. Thanks for having me. No, what I would tell you is this is an extraordinary time that requires extraordinary measures, and keep tabs on your fellow airmen, your family, and your friends. This is stressful for everyone, and it's going to be a bit of a long haul.
All right, thanks, Doc. So we're going to take a quick break. When we come back, it'll be our last segment. We'll have our feature guest, Chief Hansen, and then just some last words from both of our wing leaders. Thanks for staying tuned.
Hi, this is Major Michael Glattfelter, Major G, one of your behavioral health providers here at Eielson. Wanted to say hello to all the Eielson community out there. I know this is a super interesting time, a lot of challenges for folks in terms of being quarantined and changes that are required of us for social distancing to protect our community and to protect our mission. So wanted to just offer a few different tips to think about in terms of kind of ways to maintain our wellness through this quarantine time and time of increase in social distance. So one of the things that is important, for me at least, is maintaining a routine. So when we are having a period of time away from work, we all know this from when we're on vacation, on leave, it's easy for us to kind of have flex in our routines. It's easy to want to sleep in, play video games late, do all the things because our schedule is a little bit off. But what can be really helpful to us as creatures of habit is to maintain that routine. So thinking about, even though I'm not going to work, having kind of a similar wake time, taking a shower every day, getting dressed, just maintaining some of the things that I do throughout my normal work week in terms of maintaining my routine. One of those other key components is exercise. So maybe I'm not able to go to my yoga class, but my yoga studio is likely having a virtual class that I could take, or maybe I can check out a new yoga app or a new workout app. There's so many cool things out there. So just explore, find something new, maybe try a different kind of exercise, but just maintaining those routines in terms of sleep, exercise, eating, showering, all of those different things that are part of your routine, finding creative ways to maintain those during this quarantine time so we can maintain our wellness, and that way it's easier for us to get back to our normal routines. So take care, everybody. I'm excited that this was a way for me to connect and maintain my routine of staying engaged with the Eielson community. So thank you, and appreciate everybody that's maintaining social distance and quarantine to keep our community safe. Take care.
Good morning, Eielson. This is Dr. Peterson at the Med Group. I wanted to speak to some of the changes occurring around the Med Group. So in accordance with the Surgeon General and the Defense Health Agency, we were really trying to minimize in-person care for non-urgent issues. This is to promote and to maximize the social distancing campaign we see around the country. So within our own clinic, what does that look like? So dental clinic is shut down completely. We're not doing any dental care unless it's emergent. Mental health clinic is trying to maximize virtual care as much as possible. Specialty care clinics like optometry and physical therapy are really minimized down to just post-operative care. Our primary care clinics are still operating, both in person and virtually, though we're really trying to get as many patients to be seen virtually or over the telephone as possible. One thing to note with primary care clinics is that we are trying to prioritize the hours of 1 o'clock to 3 o'clock every afternoon for our young child less than 2 years of age well visits and routine OB visits in order to limit their exposure to the general population. Another change you're going to see is when you do come to the clinic, you'll be greeted at the front door and screened for flu or cold symptoms. If you have flu or cold symptoms, we're going to ask you to go out and around to the dental clinic where we've set up a flu and cold clinic and be seen there. If you don't have flu or cold symptoms, you'll be asked to wash your hands and come into the main section of the clinic where you'll be seen in family med. Finally, the last change you'll notice is we do have a drive-up pharmacy refill option now. So if you call in your refill for meds and then drive to the med group, park in the pharmacy refill spots that are noted out front, and then follow the directions. Somebody will bring your medications to you. That way you don't have to enter the med group. We're still here. We're still standing by to promote your best health. Please call us if you have any questions. Thanks.
You just heard Major Glotfelter and Major Peterson from the medical group. Thanks, guys, for giving us some updates there. Welcome back to the show. This is the live digital town hall, and we're in our last segment right now. Chief Stefan Hansen has joined us for this part, and we're going to talk a little bit about breakup season. So, Chief, welcome to the show. Can you talk to us about what's going on here at Eielson while we're dealing with breakup season and COVID at the same time?
Sure. Thanks for having me. So breakup season is always kind of a concern for us. It's a harder time mentally for folks. Typically, we've been cooped up, over a long, dark winter. It's starting to get light out. There's a lot more daylight, but it's still cold outside. So it's hard to get out. So seasonally, it's a hard time for us. And then you add in, COVID and having folks restricted, having people kind of locked down. So there's a lot of concern there from an emotional resilience type standpoint. And we can't forget, suicide is always a very real risk. It's the number one killer of airmen. And it's something we need to be mindful of, and it's something that we need to watch for. So what I would ask that if you're struggling right now, or if you know somebody that's struggling, reach out to somebody. We still have the helping agencies out there. We still have people standing by to help. It's a little bit harder with social distancing, but the help is still there, and it's accessible by phone. And we'll get the contact info posted up there for the chapel. They're still talking to folks. They're still available to help. We'll also get the info up there for mental health. I would ask that if you know somebody that's struggling, encourage them to get in touch. And of course, if you encounter something that's more of an emergency situation, like of course, call 911. Don't wait. Don't wait until something bad happens. Like try to preempt that. Try to get ahead of that.
Yeah, absolutely. I mean, I think this is such a weird breakup season for us because normally we would be encouraging people to get out, right, and go do things, and this is tough. So I don't know if you have any thoughts on that, sir.
Yeah, so we've talked a lot about social distancing and the importance of that. But what we really mean is that's physical distancing from each other to prevent the spread of coronavirus. What we need now is social connections more than ever. So just like the chief said, the more we can connect, and the great thing about living in the modern world is we have excellent tools on being able to do that virtually. So please make those phone calls, make those FaceTime calls, those Zoom interactions. I encourage you to reach out and do it proactive. The doctor also mentioned the importance of establishing routine, and I would put those connections into your daily routine and how you can connect with your those that you reside with, and then also, especially if you live alone, how do you connect with those close to you, and also with those that you work with, especially if you're working from home in that environment. So there's a lot of great opportunity here to strengthen connections, also for personal growth. There's plenty of opportunities online for you to develop yourself mentally, develop yourself spiritually, and then also physically. We got our workout of the days that we post here. So just because you're in a quarantine or isolation situation doesn't mean that you can't take care of your health and bolster your resiliency across the spectrum.
Right, and Chief, I think you were starting a thing called Eielson Connect, to actually get after this particular issue.
That's a perfect segue. So out of this comes a whole lot of opportunity. Like when we are sitting at home and we're looking for ways to connect, there's a ton of new opportunity to experience things maybe we haven't tried before. Something a local group here on base has gotten started on Facebook is a Facebook page called Eielson Connect. If you haven't checked that out, I would encourage you to go take a look at it. But I'll kind of give you a description of it. Kind of the intent with that page is connectedness across the Eielson community. It's ways for talented people, no matter their talent or skill, to be able to share with others through that avenue. So, for example, if you go to that page now, you'll see offerings such as guitar lessons. I know today at 1300 that there's a personal development seminar being taught by our previous command chief, Josh Hurt. Tomorrow, the guitar lessons are tomorrow at 1300. And then there's another development class being taught tomorrow at 1400 by our own Paul Hammer. What I would encourage is, if any of that stuff interests you, to go check it out. But even more so, if you have something that you want to offer to kind of throw out there to the community, I know folks have made videos of how to sew a face mask, or how to cook, like if you have cooking talent and you want to put something out there. There's another idea that's going around. It's story time with a fireman, or story time with a security forces member, or story time with a pilot, where these individuals read children's books. There's all kinds of ideas coming in from the community, but I just encourage you to go check it out and to find a way to contribute. Like, looking for the opportunity in this situation may take a little bit of effort, but it is there, and the avenue is there to connect, the avenue is there to improve and to develop out of this situation.
Excellent. So while we're kind of winding down here, I wanted to throw back to a question that actually came in the comments section. This was from Brian Heckman. He said, President Trump stated that the federal goal is to have everything sorted out by May 1st. Whether or not we reach that goal, things will go back to normal because the economy can't handle society just being shut down. Does this apply to Eielson as well, or will we be restricted further? And I read that question, sir, and I kind of think about, we were going to talk about what is normal, right? What is going to be the new normal? Do you have any thoughts on, how that kind of applies to Eielson and what our new normal could look like in the future?
Yeah, I think it's important for us all to think about what our new normal is, because this is a defining moment or defining experience for our generation, really, and for everyone that's living now, not just at Eielson, but in our Air Force, in our country, and across the globe. And I think of it in terms of, BC or before COVID and AC after COVID. And those are some discussions that we've had, even in our own family with my children. So I have young kids, 9, 8, 5, and 3. 6 and 3. We had a birthday recently. But those are some of the things that we're talking about, like what life is going to be like after this. And to be honest, I don't know exactly what it's going to be like, but I do know it's going to be different. And I do know that we can emerge from this situation stronger and more resilient as an Air Force, but also as a community. And we will, because we're going to continue to connect, like the Chief was talking about. We're going to continue to take opportunities to make it better. Regarding the specific question on May 1st, I think it would be difficult for me to forecast what the environment is going to be like on May 1st. But what I can say is that any guidance that we issue will be nested under higher headquarters guidance. And obviously, we all know that starts with our Commander-in-Chief. So we'll be in alignment with that guidance, and it'll be tailored to the situation here, just like we do with our normal command directives. So as you see, we have Department of Defense guidance that comes out, and then we issue our local guidance here to make sure that we're interpreting that properly and doing so in a prudent manner here, and also to make it clear for everyone in the community of how we're operating. So more to follow. We'll continue to provide these command directives and adapt to the higher headquarters guidance that we give, and also adapt to the ever-changing environment. But again, I'm confident that we're going to continue to thrive, even in this challenging situation that we're in as a Air Force, as a community, and as a team here.
Great. So I think it's time for some last words as we've entered the 11 o'clock hour. Chief, you got any last words for us?
The only thing I will say is something I've noticed, like even over the weekend, like it's easy for me to kind of get down and to kind of get into I don't know, just kind of a blue type mood, with everything going on. Something I've realized is it's very important to unplug from the news and to stop really paying attention to all of the headlines coming out constantly. Like that stuff can drag you down and kind of bog you down. Sometimes just getting out there and getting after a hobby. Like for me, going out and working on my car, something I enjoy. Very easy to kind of take my mind off of things going on and kind of be able to relax and enjoy the day. So I would just encourage you that it's easy to get caught up in between social media and the news, just kind of in the doom and gloom. It's good to turn that off and just go do something. Go find a hobby, or do something maybe you haven't had time to do in a while. That would be my advice.
Okay. Sir?
Yeah, final words.
Yeah.
I think of 3 words: duty, opportunity, and gratitude. So in this kind of town hall section, we talked a lot about duty, the fact that we are in a war against coronavirus, that we are combating it. And we all know this enemy can be defeated by just following the guidance that we have. And it is our duty to follow that guidance, even though when that kind of goes against our predispositioned attitude in terms of getting the job done, regardless of how we feel. I will say again, as like the doctor and I talked about, is your duty, if you're not feeling well or have any question about your personal health, is your duty to stay home. That's the best thing you can do in order to fight it. And what's encouraging is seeing everyone come together to battle this coronavirus on a unified front. And we're going to continue to provide the framework that makes that as easy as possible for everyone in uniform and out. So that's kind of my thoughts on duty. Opportunity. The Chief mentioned that word several times, mentioned the opportunity that we have to better yourself, better your team, better your family. And I would say this is an opportunity for us to all come together as a community, as an Air Force, as a country. And it's, again, inspiring to see that happen. So there's a lot of doom and gloom media out there, but there's also a lot of fantastic stories and examples of this really helping us make us better as people and better as a community. So I would say it's an uncertain environment, but the future is what we make of it. and we are going to continue to make this a environment where we can continue to thrive as airmen and families and continue to thrive with our mission. Speaking of our mission, if you haven't seen the news, but we have our first F-35 in the 354th Fighter Wing.
Hey.
So yes, it's awesome. Last week we accepted formal delivery down at Fort Worth, and we're putting the measures in place to have that delivered here at Eielson. So I expect that's going to happen in the very near future. We're going to start having F-35s flying in the skies of Alaska. So I take a great degree of inspiration from airmen across the globe. If you look at airmen in Korea, airmen in Italy, they're getting the mission done in that very contested COVID environment, and we're going to continue to get the mission done here and be able to accomplish the mission while we're also fighting that fight against coronavirus. So F-35 is on its way. That new mission is still coming forth. We're continuing to support our Alaska NORAD region operations here. We're continuing to provide aggressor training opportunities for our third wing partners down in Elmendorf, and we're continuing to bed down the F-35 and prepare for those operations. So that's kind of, I see a lot of opportunity even in this challenging environment. And then finally, I want to close with gratitude. Thank you for everyone that's listening in to this Facebook Live Town Hall. Thank you for taking an active part in combating COVID. A special thanks to all the mission essential personnel that are continuing to get the job done and really allowing us to continue to thrive as a community. And then a special thanks to all the medical folks out there. The medical community is just doing an amazing job here locally, but across the nation and across the globe. So please continue to keep those members in your thoughts and prayers.
Awesome. Well, that's the show, guys. Thank you, Colonel Bishop. Thank you, Chief Hansen, for joining us today. As always, we will continue to answer questions in the comments, even though we're coming off the air. So please, if you have any more questions, go ahead and throw them there, and we'll get some answers to you. Thanks again for everyone to listening. We will be back here next week. Seems like we did pretty well with the live streaming and no connectivity issues. So this time next week, team. Until then, stay healthy.